I'm Dr. Paya. Sir, I have few queries regarding this OPU. First is we have learned that once we are inside ovary, we don't have to take off our pedal from the switch.
Yes.
We have to keep pumping. But once we are done with one ovary, then do we need to take out the needle from the pelvis and enter again, or inside the pelvis we have to search for other ovary?
So beautiful. Now they always say, in case I've got 17 wise men today, you have covered the whole of pickups. You have covered all the pickups. All questions are coming from me. I don't have to read at all and tell you. So this is, a very good question. As you have done for the first ovary, what did we do? I had you young girls coming and aspirating, removing the dead space. You did that. And then we learnt the value of gravity.
Yes.
First of all, it was a hydrostatic negative pressure we are creating. I say hydrostatic because we're talking about water. We create a negative pressure. You are with me? Negative pressure we create. After coming, I stop it. And we see to that 1.5 ml of media is gone in the tube and that has to be discarded. Done. This we have done. Why? Because we don't want to have any dead space or air column there. You are with me? Now comes, after we have done this, and now pickup is over. And when we are going to withdraw the needle out, then what do? We
Horizontal.
take it out like this and pressure is off. And then needle is like this.
Okay.
It's like this. Now I have to go to the other ovary. So ideally, we should take out the needle. And then we do the second. Now it is called flushing. पहले केस में क्या करा? पहले केस में करा हमने removal of dead space. But यहाँ पर भी क्या करा? Now we will flush this fluid and then eradicate again the dead space. Same thing will happen again. And now we'll move to the other ovary. It's the ideal way of doing it.
Okay.
So that you know that. Now I said proficiency testing. How do we do proficiency testing? One ovary somebody has done, one ovary somebody else is doing. You can compare how many follicles we have got. So now after you've done this, then you clean it, dead space, then you go to the other ovary.
Okay.
But I don't do it because since I am doing it, all the cases, I like to I take it out and then keeping it like this only, I go to the other ovary.
Okay.
I do like that. Because I'm just telling you what I am doing. I may be wrong, but that's the way I do. But in case you want to start your practice, it should always be one ovary completed. So eradication of the dead space was the aim initially and washing of the needle. Here needle is clean, but we want to take that fluid back and you come back to stage 1 and then you go to second. So we know which ovary you have got, how many oocytes.
Okay.
That's the way I do.
One. Stop the pressure also.
Pressure has to stop.
You cannot keep on circling the vaginal
Yeah.
and all those, the bald one idea.
Okay. Few more queries, sir, regarding the same. One is that sometimes we get a patient with PID, history of PID. The ovary is stuck behind the uterus, so we have to go through transuterine or something. So how to navigate all those?
So first of all, never see. I ask you one thing. I ask all of you one thing. In case you got a ovary which is adherent situation. Ovary is adherent. You want to take out an egg from an adherent ovary. It's important because otherwise pickup is not completed. I want to ask you. Now show me your hand, Jyoti. Jyoti ka hand ban gaya uterus. And my ovaries got stuck here. Normally I will move this with a probe. I'll move this ovary up. That's what you do. Or we will just move her hand here and there. Rotate your hand. She'll rotate. I'll try to rotate her uterus and get the ovary up. Or I will slide the ovary up and get it there. Keep it like this. Now I'm stuck. I'm stuck. Ovary is stuck. Follicles are there. 1 follicle, 2 follicle, 3 follicle. Because follicles are more, it will be easy to rotate. 1 odd follicle, it won't rotate. Then what do? In case I put a needle, open, I go inside. Through uterus. It's a uterus, it's not a septa, it's a uterus. How many follicles can I take from one prick? You tell me.
Probably one or two. One or two.
Exactly. एक egg निकाल लोगे, 2 egg निकाल लोगे, done. And then after taking 2, you are not happy. So our Wolfram eater agar is not happy, you want to take 2 more, then he'll make 1 more puncture. And my dear brother, when you make a puncture, you may be ovaries adherent. So whenever ovary gets adherent, what will it do? It will pull ureters toward it. It will pull para-ovarian vessels toward it. Uterine artery, because it is, when it is getting stuck, it is getting cicatrized, no? It will get all the tissues and do like this, no? That's what scars are formed. The scarring is formed, I will pull. She's a ureter. I'll pull ureter towards me. She is an uterine artery. I'll pull uterine artery towards me. It may be an ascending uterine artery. I'll pull. So all may be bundled up towards me. And now I don't know where I'm going. And I'll be causing injury to the para-ovarian, and you'll have retroperitoneal hematoma later.
So, but so if it's densely stuck and we really need to do
Leave it.
endometriosis and or
Then do by laparoscopy
Okay. Laparoscopy.
or by bus or abdominal. But please don't, I'll tell all of you, it's a lesson of life, separate lesson.